Elaine Cameron Ford does a lot of waiting for a ride to work.
I have to use Uber and Lyft services to go and see my patients.
She's a hospice chaplain and bereavement counselor, but she's temporarily unable to drive because of a medical condition. So Uber and Lyft it is.
So you use it all the time?
I use it all the time. Sometimes I'll see 4 or 5 drivers a day.
And lately, those drivers picking her up are a little more cautious.
They think that I need to go to the hospital as a patient, and so sometimes I have trouble getting a ride.
Elaine is seeing the side effects of a new phenomenon. According to this study by a University of Kansas professor and a San Diego doctor, there's been a 7% drop in ambulance calls since Uber started up in hundreds of U.S. cities. Uber and Lyft driver
there is not too much out here that I have not seen.
Kirkland Charity Jr. has been picking up passengers for nearly 3 years. He says lately,
I've probably done about a dozen trips.
There's been a noticeable increase in the number of people he's taking to hospitals for an emergency.
It started out with just flu-related stuff and college students that were out of the area. And then it got to a little bit more serious.
Some of his most difficult trips? A person in agony with a serious pain in their side asking to go to the ER.
Yeah, the one where the young lady was in labor, that was, that one made me really nervous.
Kirkland said the reason for these calls for rides to the hospital is pretty clear.
Costs.
An ambulance is not just a vehicle. An ambulance is a vehicle with highly trained personnel, equipment, medicine that can save your life.
It's the difference between being a passenger and being a patient. In some cases, it's totally appropriate. Maybe they don't need to go to a hospital. Maybe they can go to an urgent care or even their doctor.
If it's not a major trauma, Chip Decker says calling an Uber is an easy option. But
if you don't know what's going on, if it's trauma, if it's heart, if it's head, altered level of consciousness, your ambulance is probably your best bet.